Hi everyone, my name is Navin Kumar and I'm a third-year gastroenterology fellow at the Brigham and Women's Hospital. And I'll be speaking today in my study in GIE entitled the Safety Assessment Tool. Now, it is well understood that faculty assessment plays a critical role in fellow skill development, both clinically as well as endoscopically. Fortunately, there are a few assessment tools that have been validated in a trainee population. The most commonly known one is the Mayo Colonoscopy Skills Assessment Tool, or the MCSAT tool. Now, where the MCSAT excels is in generating a wealth of information from a single supervised procedure. However, its comprehensive approach, which consists of 16 to 18 questions for the faculty evaluator to complete, does make the tool more useful as an interim assessment tool as opposed to continuous assessment tool. Now, why is this important? Well, each time evaluation occurs, a learning cycle ensues in which performance is assessed, feedback is shared, and change is implemented, resulting in a real-time learning cycle. These learning cycles are greatly increased in frequency when continuous assessment occurs. With this in mind, our aim for this study was to develop and validate a concise evaluation tool for fellow performance in colonoscopy that would be used on a continuous basis. We named our tool the Skill Assessment in Fellow Endoscopy Training, or SAFETY tool, and it consisted of 5 different questions. The first question asked the faculty evaluator to indicate how far the fellow reached on the colonoscopy without any hands-on assistance. The next 2 questions covered case complexity. The second question covered the complexity of the insertion of the colonoscopy procedure on a 3-point scale. The third question was complexity of any interventions performed, again on a 3-point scale, ranging from straightforward, such as a biopsy, to challenging, such as a complex polypectomy. The fourth question was one of summative assessment, or the overall performance of the fellow on that procedure. We used a 5-point scale for this question that ranged from beginner, 1, to superior, 5, based on the need for hands-on assistance, coaching, as well as timely completion of the procedure. Our 5th and final question was one of formative assessment, or a specific area for the fellow to improve on based on this case. The faculty evaluator had a pre-specified list of 12 different cognitive and motor-based skills to choose from for this last question, which were all influenced by the colonoscopy core curriculum as well as previously validated assessment tools. Once developing the safety form, which we did with a team of endoscopy educators, and then reviewing with our fellows as well as attendings, we then collaborated with MIT to have the form adapted into a web-based application, one that would be optimized for smartphone as well as computer use. We started the study at the beginning of the academic year in July of 2016 and ran it through for 6 months, with 15 fellows, 5 from each year of training, and 26 faculty evaluators over 3 different clinical sites. For each supervised colonoscopy, a safety form was requested to be completed by the faculty evaluator. Over the course of the study period, 350 safety evaluations were completed. Of these, a subset were reviewed by an independent evaluator who also completed the safety evaluation form as well as the MCSAT form. In terms of results, the number of safety evaluations completed were well distributed amongst the 3 different fellowship years, and our faculty utilized all 5 points of the overall performance scale with no obvious ceiling effect noted. When we looked at the safety overall performance score by trainee year, we found that overall performance significantly increased with each additional year of experience. We then compared the safety overall performance score by cecal intubation and found that those cases that had successful cecal intubation had significantly higher rates of performance compared to those without successful cecal intubation. Lastly, we looked at our safety overall performance score by case complexity and found that with increasing case complexity, the overall performance significantly declined. From the dual observed procedures, in which the independent evaluator completed the safety evaluation form in addition to the MCSAT, we then were able to obtain reliability data. We found that the safety overall score had excellent inter-rater reliability between the independent evaluator and the faculty evaluator with a kappa agreement statistic of 0.898. We then compared the safety overall performance score to the Mayo colonoscopy skills assessment tool in terms of motor-based tasks as well as overall motor skill, and found excellent correlation with a Pearson's correlation coefficient above 0.90 for all listed tasks. At the conclusion of the study, we sent a survey out to all of our faculty on the usability of the web-based application. And what we found was that 100% of our faculty agreed or strongly agreed that it was easy to use and that it took less than 2 minutes to complete after a procedure. Many of our faculty also offered additional comments about the use of the web-based application, and many cited the fact that the tool served as a helpful reminder to provide feedback to the fellow after each supervised case. So in summary, we developed and validated a novel and concise evaluation tool for fellow performance in colonoscopy that contains just 5 questions for faculty members to complete, is reliable with excellent inter-rater reliability as well as a high correlation to a previously validated assessment tool, and that's web-based and therefore easy to use as a continuous assessment tool for fellow performance. We imagine this tool will have several applications in the educational sphere. For one, fellowship program directors will be able to track fellow performance over time as well as their overall fellowship. Faculty members will be able to utilize the previously completed evaluations to tailor their teaching to individual fellows. And we imagine this tool will be helpful as an outcome measure in educational-based studies to assess the impact of an intervention on fellow performance. In terms of future directions, we are currently working on an externally facing web-based application that can then be utilized by any interested fellowship program. We also hope to launch a multi-center study such that we can study the usefulness of this tool across multiple sites. So thank you again to GIE for this opportunity to speak on our research on the safety assessment tool, and we hope you all look forward to reading more about the study in an upcoming GIE issue. Thank you again.